Atrial fibrillation. So basically, atrial fibrillation is a heart condition in which the heartbeat is irregular and the rate is greater than 350. So talking about causes of atrial fibrillation, the causes will be enlargement of the myocardial cells and ischemia, infarction, congestive heart failure, hypertension, rheumatoid heart disease, and other non cardiac causes will be chronic obstructive pulmonary disease, pneumonia, and acute pulmonary embolism. Other than that, other causes will be thyrotoxicosis and increase in alcohol intake, also known as holiday heart syndrome, and also pheochromocytoma. So these are the causes for atrial fibrillation. Now we will talk about the complications. So the complications for atrial fibrillation is thrombus formation and stroke. For the atrial fibrillation, stroke is one of the major complication and must be looked upon to when we find a patient with the symptoms of signs and symptoms of this atrial fibrillation. So the signs and symptoms we can see in the patient is chest pain, palpitations, altered mental status, decrease in blood pressure. And how do we diagnose it? By using tools, various methods is by ECG. So in ECG we can see absence of P waves, and we can also go for X-ray to rule out pneumonia. We will see cardiomegaly in some cases, and also chronic obstructive pulmonary disease, and have talked about it that it is one of the causes of atrial fibrillation. And also, as the myocardial infarction is also one of the causes, so troponin levels can also be measured thrice in 24 hours. T3, T4 levels, blood alcohol level, and urine metanephrine level. And we can also go for transthoracic echocardiogram, and we will see atrial enlargement, mural thrombus, basically atrial enlargement of the left atrium, and valve disease such as mitral stenosis. So now we will look upon to the ECG strip, and as we can see here, these are the P waves, absent P waves, and this must not be confused with atrial flutter, which has sawtooth P waves. And atrial fibrillation does not have P wave, absence of P waves. And moving on to treatment for atrial fibrillation, the treatment will be beta blockers, that is metoprolol, calcium channel blockers, diltiazem, and anticoagulant such as heparin or warfarin. So we'll look at the patient and check if the patient is hemodynamically stable or unstable. If the patient is unstable, then we'll give anticoagulant and then immediate cardioversion. And if the patient is hemodynamically stable, then we'll go for anticoagulant plus cardioversion, but after 6 weeks. So how do we know that we have to give heparin or warfarin? For that we have the criteria known as Chats was criteria score, or we can also say score. And if the score is greater than 3, then we'll give warfarin. If it's less, then we'll go for heparin. So this was it about the atrial fibrillation.